So this question's about the evidence-based learning presentations that you've just done. Now, from what I understand was that you did an assessment and you had feedback on it, so it was given a grade marked. And then from that feedback you then create, you're given a template and then you had to do a presentation. Okay, so I'm right. Okay. So this presentation wasn't graded?
No.
So what's the value of it?
It's designed so that if we can write an essay, we should be able to convey what we've learned. So it's very easy to read some literature and say, well, they've said this, so I'll say it. But to actually convey it, you have to understand it.
Okay.
So it helps us to recognise that you can't just keep information to yourself, you have to be able to share it.
And we'll have to present as doctors. You know, there'll be regular teachings where as juniors we'll have to share with other juniors, as regs we'll have to teach juniors. You know, presenting and teaching is sort of a theme throughout medicine.
And it's the idea of evidence-based medicine in itself is becoming more and more important with NICE guidelines and clinical recommendations. And being a competent doctor involves being able to decide whether something is worthwhile, whether it works for your patients. And for me personally, this was different from any research that I'd done before because my first degree was languages and literature. So I was quite overwhelmed by this. Statistics is just completely foreign to me. So in that way, I learned a lot of new skills. So statistics, I'd never seen those databases before, PubMed, and I used completely different databases. And I was looking at completely different things when I wrote essays in the past. So I suppose coming from my background, it was quite a steep learning curve.
Yeah, you had to do that for the assignment, for the assessment. So it's this value-added thing. I mean, what's been mentioned so far has been, I'm picking up, well, there's the communication skills, there's the bit about, well, I've got to know it really well to communicate it. So is there anything else?
Teamwork. And it's again going back to the PBL teamwork, where I don't have time, for example, to learn about what Kirsty did and in depth,
Okay.
what Mia did, what Beth did. So I sat there because they've already done the hard work, and I could listen to what they were saying, and then I could learn about all the tests that they are looking at, and then of course use the skills that I have picked up to say, do I think is relevant to the patients that I will see, or I have seen already. So that way you're also doing an easy version of learning a lot, sitting there, just listening. So it's, and that happens quite a lot in PBL because, say, for example, Beth might know quite a lot about stroke trials, and they might tell me a lot about different things that I had no idea, and it take me hours to go and learn. And in PBL, she might, because we do PBL together, she might say something in context of a patient, and then that's it, I've just learned something, and if I want to look something up, I can go and look it up, but other than that, that's done. So it's quite a lot of learning from each other.
And you're asking questions that perhaps you wouldn't have been able to ask at the start of the course.
Absolutely, yeah.
It's to view it differently.
Yeah, definitely.
To view it clinically is, I think, the key thing that I've found different. Because before I could have viewed it from a science perspective,
Absolutely.
and in reading the literature, it was very hard to step away from how they elucidated the data in the first place in terms of the trial itself, which is something that my degree previously focused on. But now it's kind of deciding whether what I'm reading is useful to a patient. And it's the value addition in doing presentation of making you think. Because obviously in our essay we did relate it to the patient, but it's really trying to convey how it's useful that you don't necessarily include in an essay.